So this video is mainly for the men in the house. Now, if you're a man, you want to come close. Now, if you're a man and you're up to 40 or 45 years of age, come even closer. But you see the front row. Let's reserve it for those men that have a family history of a prostate cancer or prostate disease in their family. Now, you're a man, but you notice that you're always struggling to pee, or your urine flow is appearing weak. Now, this might not be as a result of aging, like most men would just assume, because you're growing old and that's why you're experiencing some of this. Well, this could be your prostate sending out a distress signal to you that there is trouble ongoing with it. Now, this is something most men don't know, but your prostate has the ability to grow silently and gradually until it gets to the size where it starts to choke on your bladder. And by the time it starts to choke around your bladder, it now causes a lot of symptoms that can mess with your life. And some of these symptoms, or some of these symptoms that your prostate is actually showing you, may be a pointer to a more sinister problem like a cancer of the prostate. So in today's video, we're going to be talking about some of the signs that our prostate gives us, telling us or calling our attention to troubles ongoing with it. So number one, you're peeing way too often, especially at night. You just notice that for some reasons you're waking up 2, 3, 4, even 5 times to pee at night. Now, this may not be age related. It could be as a result of an enlarged prostate that is now pressing or choking around your bladder, causing you to feel that need to go ease yourself more frequently. Number 2, weak or interrupted urine flow. Now, you just notice that your urine, the flow of your urine or the stream of your urine is looking like a leaky faucet, just coming out very weakly. Or you notice that your urine flow is stopping midway. It's not that you finish eating yourself, but midway to just stop abruptly. Now, this could be a distress signal from your prostate telling you that there is trouble ongoing. Number 3, hesitancy or straining. Now, here is the thing. You're feeling like you want to ease yourself. You've gone to the restroom to ease yourself, but you just notice that when you get to the restroom, the urine would not just come. You'll wait for some strange reasons. You keep waiting and waiting, but urine is not coming out. Not because you don't want to ease yourself, you're pressed, but urine is not just coming out. Or in some extreme cases, you have to literally strain or force yourself before the urine comes out. Well, this too is indicative of an obstruction along your urinary path, which could be from an enlarged prostate. Number 4, incomplete emptying. Now, you've gone to ease yourself, but you just notice that for some strange reasons, every time you ease yourself, you have this feeling like, oh, there is more urine inside your bladder and you've not completely emptied yourself. Now, this too could be a pointer for an enlarged prostate. Now, another sign which is a strong pointer to a disease of the prostate is what we call terminal dribbling. Now, here's what happens. You've gone to ease yourself. You finally are able to start your urine and you're easing yourself, but you notice that towards the end of your urine stops in a very funny way. It stops, it starts, it stops, it starts, it keeps dribbling and stopping before it finally stops. Well, this too is a strong pointer to an obstruction of the free flow of urine, which could be caused by an enlarged prostate. Now, number 6, blood in your urine or your semen. Now, for whatever reason, blood in your urine or your semen is never normal and should always be properly evaluated and treated. Now, this is because it could be a pointer to a more sinister problem or a more sinister danger like cancer of the prostate. Now, number 7, especially for men in above 40s, 50s, you're noticing that there is this persistent pain in your lower back, in your thigh, or in your hips. Please get it evaluated and checked, as sometimes persistent pain in the back, in your thigh, in your hips could be a pointer to a cancer of the prostate that has begun to spread to the bones. Last but not the least, you're experiencing some erectile issues or some discomfort during ejaculation. This too could be a pointer to a problem ongoing with your prostate, as your prostate plays a very important role in your performance in the bedroom. So, if you're experiencing any of the symptoms or all of the symptoms that we just mentioned, you want to visit your doctor. But what should you expect when you visit your doctor? By the time you visit your doctor is going to carry out some clinical examinations on you, as well as request for you to go and do some investigations. Now, you hear us say things like, oh, we want to do a DRE for you. That's a digital rectal examination. This is just to help us ascertain if your prostate is enlarged in the first place, and then the nature of the enlargement. Also, your doctor will send you to go and do a urine test. This is just to rule out the possibility of an infection causing some of the symptoms that you may be experiencing. We also want you to do an abdominal pelvic ultrasound scan. And lastly, we'll send for a blood test, which most of us would have heard by now, and that's what we call a PSA, a prostate-specific antigen assay. Now you've done your investigations and your lab works are back. When your doctor is telling you that your PSA levels are elevated, your PSA level is high, what could this mean? Does this mean that you have prostate cancer? Well, follow us in our next video because we're going to be talking about what an elevated PSA level could mean, who should get tested routinely during the PSA test, and lastly, some of the risk factors that could increase or predispose you to coming down with a disease of the prostate.